afternoon. I'm Shawnee Au, and this is One News Now. The Octa Research Group says the rise in COVID-19 cases across the Bicol region is still manageable. In today's Laging Handa briefing, Professor Guido David noted an uptick in new COVID infections in the cities of Naga, Legazpi, and Sorsogon. David said the surge is not yet alarming because hospital occupancy in the three cities are still below critical. His statement comes after several doctors in the Bicol region asked the Interior Department to place the region under ECQ status from the less stringent modified ECQ.
It's their choice, syempre, to if they want to upgrade to a stricter quarantine classification. Hindi naman natin ito-contradict yan if that's what they want. But I think they could still manage it even if they're under, let's say, GCQ.
Bicol Region's COVID-19 situation further. We have Albay Medical Society President Dr. Carlson Antonio joining us over the phone. Good afternoon, Dr. Carlson. You were one of the signatories in this letter that was sent to the DILG about upgrading the Bicol region to ECQ status. We want to know, Doc, what's the situation like on the ground from a doctor?
Yes, good afternoon, Sean, and thank you for inviting. Currently in the region, we have seen a increasing trend in the amount of admission as evidenced by a wait list in the hospitals. For example, around 10 to 20 people waiting in the ER just to be admitted because of the lack of vacancies of the available bed. So this prompted one of our colleagues to write a letter, and us, being the representative of the respective societies in the local chapters, Albay Medical Society, Camarines Sur Medical Society, Sorsogon, Masbate, and Camarines, we appended our signatures for support because of the increasing trend, because if not, if left unchecked, this may lead to a worse outcome.
Right,
So
Doc, yeah. And exactly that is what we're wondering. What do you think is driving this rise in cases from what you've observed? Can we actually attribute this to new variants or just a relaxing in protocols, or is there increased community transmission?
Yes, that is a very... I'm sorry, may slight echo, kaya medyo naiilang ako. Yeah, better. So what you said was very informative because, in my opinion, it is a multifactorial cause because of the leading to the rise of the cases. There may be variants or undetected variants, and there may be a degree of local transmission because here households are testing positive. Most of the members of a household coming in for checkup can turn out to be positive. As for the laxity in implementing the health protocols are there, but of course it is up to the individual to stringently follow it every day.
Right, and Doc, what about the vaccination drive there in the Bicol region? How's it going based on your observation? Also, are there enough supplies? Is the uptake positive, or is hesitancy an issue over there?
Yes, I'm glad you brought that up. Vaccines are available here, albeit on a staggered basis. For example, for the healthcare workers, I think about 77 to 80% are already vaccinated here in Albay. The target is 85%. And as for the general population, I would agree that they still have hesitancy to get the vaccine. I personally have some acquaintances that are very eligible for the vaccine, that need the vaccine, but they refused the registration because of their unfounded fears. So yes, I would say vaccination is still not adequate here because of those factors. Mostly fear of the people, hesitancy. Yes, that's it.
All right, so very quickly, Doc, just to make sure we're on the right page, or we're aligned, or you are in favor of putting the entire Bicol region under ECQ status, yes?
On first draft, the letter said we were requesting ECU, but upon further deliberation and after a meeting with the Bicol Regional IATF together with DOH and the IATF chairperson, Attorney Nuida, we were enlightened of the real data here, and we are not pushing for ECQ anymore. The greatest compromise and the best compromise will be maybe MECQ, like that imposed in Naga City 2 nights ago.
All right,
Because
very clear. Very clear, Doc. I'm sorry we run out of time, but thank you so much for all your insights and your explanations. Stay safe there in Bicol. That was Dr. Carlson Antonio, President of the Albay Medical Society. Thank you for your time. We'll have more stories after this quick break. Stay with us. Yung pencil na, yung retractable. You're still watching One News Now. I'm Sean Yao. Hospitals in Cagayan de Oro City are getting full amid a rise in COVID-19 infections. We have Jem Avancenia joining us from Cagayan to discuss that further. Jem, how are healthcare facilities there in CDO coping with this new spike in COVID-19 infections?
Sean, even the Northern Mindanao Medical Center, or the NMMC, which is the main COVID-19 referral hospital here in Region 10, have already reached their maximum capacity for COVID-19 cases. Despite this, healthcare workers are hoping that with the extension of modified enhanced community quarantine status here in Cagayan de Oro City will help bring down the number of infections. NMMC Chief Dr. Jose Chan said they had to expand their ICU bed capacity for COVID patients from 30% to 50%. City Health Officer Dr. Lorraine Neri said their health utilization rate surged to 78% last week after having an average daily cases of 100. Neri said that they have intensified their efforts in immediately isolating all positive cases in their temporary treatment monitoring facilities. Aside from this, MECQ guidelines are also being strictly imposed in Cagayan de Oro City. Meanwhile, the vaccination of government employees, including teachers and law enforcement authorities, started in CTO this morning. Members of the A4 priority groups were given Pfizer vaccines today. The city government of CTO is asking the national government for additional vaccines as they ramp up inoculations. Sean, as of Tuesday, COVID-19 cases here in Cagayan de Oro City have reached nearly 9,000. More than 1,600 of this number are active cases. Sean?
Thank you so much for that update, and stay safe down there in Cagayan de Oro City. That was News 5's Gemma Vansenia. Thanks, Gem. And in other news, Quiapo Church will no longer be using disposable plastic for the upcoming feast of St. John the Baptist after getting called out by an environmental group. Camille Samonte with the story.
An environmental group, Eco Waste Coalition, has called out the Quiapo Church for its decoration for the Feast of St. John the Baptist. The Quiapo Church used disposable plastics as banderitas in preparation for the festivity. The coalition said the use of such decorations is not in line with Bishop's stance for environment, especially now that the world is in climate emergency. Tin film bags is among the most destructive garbage found on land as well as rivers and oceans. The coalition is urging all the church to stop using decorations that will only contribute in plastic pollution. Authorities from the Quiapo Church admits that the use of disposable plastic decorations are prohibited and vowed to replace it.
Totoo yan. Kung pwede natin palitan yan, ito naman, tinatanggap natin yan. So, gagawa tayo ng mga hakbang para palitan yan. Alisin yan, kasi bawal nga yung mga plastic, yung mga circular ang kwan.
Father Coronel said they just repeated their decorations to save money.
Hindi tayo perfecto, pero tinatangka natin yan. Dati na yan. So, yun na muna, makikinig tayo sa mga mungkahi.
The feast day of San Juan Bautista will be on June 24. For News 5, Camille Samonte, we are One News.
Here are other stories we're keeping our eyes on. Quezon City is considering to terminate its contract with Zuilig Pharmaceutical after a series of technical issues with its Easy Consult service. Mayor Joy Belmonte says the platform is putting all the city's vaccination efforts down the drain as many residents still cannot sign up. Human rights lawyer Chel Diokno has announced that he will be running in the 2022 elections, but he has yet to specify for which post. Diokno says the country's justice system will not be fixed unless people in power see the problem and do something about it. And in sports, Gilas Pilipinas will take on South Korea in the FIBA Asia Cup qualifiers at the Angeles University Foundation later at 6 p.m. Fans are anticipating a deadly twin tower combo from 7'3" teen Kai Soto and newly naturalized Filipino Ange Kuwame. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.
Iba, diba?